Pressure ulcers, also known as pressure sores or bed sores, can cause a great deal of pain and discomfort. They are caused by pressure when you are sitting or lying in the same position for too long, and pain is often the first sign that something is wrong. Pressure ulcers can happen to anyone. For example, you may have experienced the discomfort from pressure when travelling on a long journey and your bottom feels numb, or when you wear new shoes and develop blisters on your heels. Pressure ulcers can begin quickly if pressure is not relieved. It is estimated that just under 500,000 people in the UK will develop at least one pressure ulcer in any given year. Pressure ulcers are more likely to happen to people with an underlying health condition who are immobile or who are unable to move themselves. Within this easy step-by-step guide, we are going to help you understand how pressure ulcers can develop and how we can help you to prevent them from happening and stop the pressure. Chapter 1. Who is at risk? So who is at risk? Although older people have a greater risk of developing a pressure ulcer because of different health conditions, remember they can happen to anyone. You're at risk of developing a pressure ulcer if you suffer with a health condition that affects your ability to move, if you have a physical disability, or have suffered with paralysis, multiple sclerosis, a stroke, or dementia. Your short-term mobility may also be affected after an operation. But don't worry, pressure ulcers can usually be prevented, and we're going to tell you how. You're also at risk of developing a pressure ulcer if you are sitting or lying for long periods without moving and do not eat and drink adequately. Chapter 2. Where can pressure ulcers develop? If you're a bedbound patient or looking after someone who is, the most likely places for pressure ulcers to develop are the buttocks, elbows, ears, spine, shoulders, heels, hips, the back of your head, your toes and tailbone. Remember those vulnerable areas of the body by thinking of best shot. If you are a wheelchair user or sit in an armchair, you are more at risk of developing pressure ulcers on your hip bones, buttocks and heels. Chapter 3. How do pressure ulcers develop? Pressure ulcers can begin to develop in a few hours and will become worse over a number of days if pressure is not relieved. When pressure is against your skin from a surface such as a bed, chair, or even new shoes, the surface presses against your skin and squashes the skin surface, as well as the deeper tissues closer to the bone. Blood vessels normally run through your skin, keeping it healthy with oxygen and nutrients. When those blood vessels are squashed by pressure for too long, they can no longer keep that part of your skin healthy, and a pressure ulcer will begin to develop. The beginning of a pressure ulcer can be seen as a red or inflamed area on the skin. You're likely to experience some discomfort at this point, or a feeling of numbness, which is a warning sign that something is wrong. Chapter 4. How do I know if I have a pressure ulcer? If the area is painful and does not turn white when pressed but remains red, you have developed a stage 1 pressure ulcer. These are early warning signs, and you need to report it to your carer, nurse, or doctor, who will provide you with the right advice. The best way to test an area of skin for a pressure ulcer is to look at your skin and carry out a skin test. If you see any reddened areas over the bony parts of your body, you can lightly press the area with your finger and count to 15. When you remove your finger, the area that you have pressed should now be white or blanching. This means your skin remains healthy. If you have dark skin, it is unlikely that you will see the redness or the blanching, so be aware of pain or purple discoloration across the bone. Chapter 5. How serious can a pressure ulcer be? There are 4 stages of pressure ulcers, and it's important you're aware of each stage and understand that if left untreated, they can become more severe. Pressure ulcers are painful and can take weeks or months to heal, so it's best to stop them in the first place. Stage 1 pressure ulcers are often discoloured and do not turn white when pressure is placed on the skin. These may hurt or itch and tend to feel warm or spongy. This stage can be prevented from getting worse, but must be managed as soon as possible. In stage 2 pressure ulcers, the outer surface of the skin and part of the second layer of skin is damaged, leading to skin loss. The ulcer looks like an open wound or a blister. This can happen from prolonged pressure, but may also happen if you drag your skin across the bed or chair. In stage 3 pressure ulcers, skin loss occurs throughout the entire thickness of the skin. The underlying tissue is also damaged. However, the underlying muscle and bone are not damaged. The ulcer appears as a shallow or deep cavity-like wound, in other words, a hole in your skin. Stage 4 pressure ulcers are severe. The skin will be badly damaged and the surrounding tissue begins to die. The muscles or bone could also be at risk of damage. Stage 4 pressure ulcers can lead to life-threatening infection, so it's important that you get them treated as soon as you notice the first symptoms. If you are at very high risk or suffer with a stage 3 or stage 4 pressure ulcer, you may need a higher level support surface that creates movement. Chapter 6. How do you stop pressure ulcers from happening? So, how can we help you prevent pressure ulcers from developing? Your community nurse or carer can assess your individual circumstances and will take into account your ability to recognise pain and your ability to move. Your diet, continence state, and blood circulation will also be assessed. They can help create a plan of care specifically to meet your needs. An easy way to remember the 5-point action is to think skin. S is for support surface. A support surface is a special mattress, cushion, or heel protector that will relieve pressure. There's a range of support surfaces available to meet your needs. Your community nurse or tissue viability nurse will assess your need and order the mattress and cushion required. Memory foam is a special foam that conforms to the shape of your body and spreads the pressure. If you are not mobile and sitting for long periods of time, your heels and bottom are at particularly high risk from pressure damage, and keeping the pressure off is very important. Remember that if you are wearing the heel protectors, you must not walk in them and can take them off easily by loosening the Velcro straps. If you are at very high risk or suffer with a stage 3 or stage 4 pressure ulcer, you may need a higher level support surface that creates movement. The second S of skin stands for skin assessment. To prevent pressure ulcers, it is important that your skin is assessed regularly. You may be able to do this yourself with the help of a mirror. Alternatively, your carer or nurse should assess your skin. If you notice any changes to your skin or any redness, you must tell your carer, your nurse, or contact your GP. The K stands for keep moving. If you cannot walk independently, you will be at risk of developing pressure ulcers. Regularly moving is the best way to stop pressure ulcers from developing. This may be difficult, but standing for 2 minutes every hour or changing position while in your chair or lying in bed reduces the pressure on any vulnerable areas. You will need to keep moving even when you have the right support surface. If you are a wheelchair user, you are advised to keep regularly moving to take the pressure off your bottom and lower back. This may be achieved by lifting yourself up for a few moments, or you may need assistance with lying on your bed for an hour or 2. If you are bedbound, you should change your position regularly during the day. If you struggle to change position yourself, a carer or relative should assist you to ensure the pressure is relieved. The I in skin stands for incontinence. If you suffer from bladder or bowel problems, you may experience wetness on your skin from urine or loose stool. It is important to keep skin clean and dry. Wet or soiled skin can become weak and less resistant to pressure. A continence pad will help to keep your skin dry, but if your skin does become wet or soiled, it should be cleansed with water and an allergy-free soap, and then gently patted dry. If you are wearing a pad, do not use a barrier cream because this will prevent the pad from absorbing the wetness. It is advised that you do not use talcum powder or perfumed products such as perfumed soaps and bubble bath, which can irritate your skin. Finally, the N in skin stands for nutrition. Eating a healthy, well-balanced diet and drinking at least 8 cups of fluid a day will help to prevent pressure ulcers from developing. Protein and vitamins are part of a balanced diet and keep your skin healthy. If you do have a pressure ulcer, they also help with the healing process. If you are suffering with weight loss or a low appetite, your GP may refer you to a dietitian to create the best plan for you. Prevention is better than cure, so take action now. Regularly look at your skin and be aware of any sign of pressure damage, keep the pressure off, and if any changes in your skin appear, inform your carer, nurse or GP. If in doubt, check it out. The Nottingham City Care Tissue Viability Service is available to offer advice on both the prevention and treatment of pressure ulcers.